This nasal spray is used to temporarily relieve congestion in the nose due to conditions such as the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose, which helps reduce swelling and congestion. It is important to use this medication as directed by your doctor. Typically, the recommended dose is 1 or 2 sprays into each nostril once or twice a day. It is best to use this medication at the same time each day for the best results. To use this medication, follow the instructions on the product package or as directed by your doctor. Before using the nasal spray, gently blow your nose. Close one nostril with your finger and keep your head upright. Then, place the spray tip into the open nostril and spray the medication as you breathe in through your nose. Repeat the process for the other nostril if necessary. Make sure to avoid spraying the medication into your eyes or onto the middle of the inside of your nose. After each use, rinse the spray tip with hot water or wipe it with a clean tissue and replace the cap. It's important to note that this medication only provides temporary relief, so do not use it more often or for longer than directed by your doctor. Using it excessively may increase the risk of side effects and could lead to a condition called rebound congestion. If you experience symptoms of rebound congestion, such as long-term redness and swelling inside the nose, stop using the medication and consult your doctor or pharmacist. If your condition worsens or persists after 3 days of using the medication, be sure to inform your doctor. It's important to note that some temporary side effects may occur when using this long-acting nasal spray. These can include burning, stinging, dryness in the nose, runny nose, and sneezing. If any of these effects last or get worse, it's important to notify your doctor or pharmacist promptly. If you've been prescribed this medication by your doctor, it's because they have determined that the benefits of using it outweigh the potential risks of experiencing side effects. In fact, many people who use this medication do not experience any serious side effects. However, it's important to contact your doctor immediately if you do experience any serious side effects, such as changes in heartbeat, dizziness, nausea, headache, changes in mood, trouble sleeping, shaking, unusual sweating, or unusual weakness. While it's rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's also important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed above, be sure to contact your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this long-acting nasal spray, it's important to consult with your doctor or pharmacist if you have any allergies or health conditions, such as heart disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating due to an enlarged prostate. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only when necessary and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this nasal spray if you are breastfeeding. Children may be more sensitive to the side effects of this nasal spray, so make sure to check the product package or consult with your doctor or pharmacist about its use for children. When taking this medication, it is important to follow the recommended dosage and use it at the optimal timing as prescribed by your doctor. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medications without your doctor's approval. It's crucial to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzyme, procarbazine, razagiline, sulfinamide, selegiline, tranylcypromine, while using this medication, as it may cause a serious and potentially fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before starting this medication. Make sure to consult your doctor about when to start or stop taking this medication. If someone overdoses on long-acting nasal spray 0.05% and experiences severe symptoms like passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, you should contact a poison control center right away. In the U.S., you can call 1-800-222-1222 to reach your local poison control center. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's important not to share this medication with others, as using the same container with someone else can spread infection. There are different nasal decongestants on the market, some of which can be bought without a prescription. It's best to consult with your doctor or pharmacist to determine which product is most suitable for you. You can use long-acting nasal spray 0.05% to relieve symptoms of seasonal or perennial allergic rhinitis in adults and children 6 years of age and older. It can also be used to prevent seasonal allergic rhinitis symptoms in adults and children 12 years of age and older. The usual dosage is 1 spray in each nostril once daily, although your doctor may prescribe a different dosage. It's best to use the spray at the same time every day. Make sure to check the storage information on the package and keep the medication away from heat and light. Always keep medications out of reach of children and pets. Do not flush this nasal spray down the toilet or pour it into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.